Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. And in 2 minutes and 47 seconds, we're going to be kicking off Insights Live. So this is 30 minutes of dialogue about what we learned at Teach to Reach 8. What is Teach to Reach? Teach to Reach, the last time it happened was on the 16th of June, 2023. 16,835 health professionals, primarily immunization and other primary healthcare professionals, came together to share experience around challenges that we face on the ground. A lot of peer learning in large plenaries, but also peer learning through one-to-one networking. Today is the day 3 weeks after the event where you're going to hear firsthand from Teach to Reach 8 participants what they actually learned, gained, and what they're doing with what they have learned and gained. That'll be in just under 2 minutes. See you there. All right, 1 minute and 34 seconds before we kick off Insights Live. So this is the first time we'll be discussing what we're learning from Teach to Reach 8, this massive event held on the 16th of June, 2023. 16,835 health practitioners from all over the world, from all levels of the system, sharing experiences, reading, thinking, reflecting, and sharing what they're learning. That's what we're going to do in particular today. I'll see you in 1 minute and 5 seconds. We want to say hello back to Odukoya Adesoji Olatunde from Nigeria. A warm welcome to you, Adesoji. Please let us know what you learned from Teach to Reach 8. We're keeping an eye on your comments. Abubakar Musa wants to ask more frequent questions. Okay, Abubakar, please do. We're starting in 45 seconds, and we certainly hope you'll have a lot of questions and comments throughout the event. You're watching us on YouTube. We're keeping an eye on those comments. See you very soon. Only 30 seconds left until we kick off with this Insights Live. What do we actually learn from Teach to Reach 8, this massive event? Over 16,000 health practitioners coming together to share their experiences. So what? That's what you're going to tell us. Why you came once, but why so many of you have keep coming back to Teach to Reach, as this is the 8th one and the 9th one if you count the Teach to Reach conference. Here we go. All right, a warm welcome to you from Geneva, Switzerland, from the Geneva Learning Foundation. We are here for what we call Insights Live. So let's, Insights Live is really sharing the insights by and for the people who make global health. Just as a preamble, if you have poor connectivity, you'll be able to hear everything that is said in today's Insights Live by going to www.learning.foundation/podcast. You can subscribe to the podcast and get all of the content. It's audio only. It's just like listening to the radio, so you don't get the video, but it's a lot less costly to connect with the podcast. We're talking about Teach to Reach Connect, a massive event that happens on a regular basis to support health professionals to meet, network, and learn. We're going to kick off with our first question, really. What did you learn from Teach to Reach 8 on the 16th of June, 2023? We're going to start with, let me see, I hope she is still here, with Helen Osowo from Kenya. Helen, I hope you're able to speak and your connectivity is with you. And we'd like to hear... you may need to turn down the volume for me because we can hear my voice in the background. Can you introduce yourself? Tell us who you are and what you do, first and foremost. All right. Helen, are you able to hear me now? And were you able to hear my question? Just asking you to introduce yourself.
Yes, my name is Helen Apondi Osowo. My background is nursing. And currently I work at coordination level. I coordinate vaccination services in a district. And previously, for the longest time, I have worked as a service provider in immunization area. That's what I do. I'm in Kenya, Siaya County.
Wonderful. And can you tell us, was this the first time that you attended Teach to Reach?
Sure. This was my first time that I attended Teach to Reach 8. And it was a pleasure being there. I picked some lessons.
That's good to hear. Who told you about Teach to Reach? Why did you decide to try this?
I got Teach to Reach from a friend, colleague of mine.
All right. So, okay, wonderful. Now, what did you learn, in fact? What's the most significant learning that you took away on the 16th of June after having attended Teach to Reach, listening to people in group peer learning sessions, but also meeting individually in private one-to-one networking sessions?
I did learn a lot from Teach to Reach 8. From the effects of COVID on health, why people are working on health, and a lot of learning. But the most striking that I would like to highlight was the use of technology in improving services. Unfortunately, I may not remember the person I networked with, but I learned that technology has improved provision of health services, and particularly around vaccination, since continuous learning can be done through technology, and people don't have to basically come and meet in person, which is rather expensive.
Okay, Helen just muted herself. I hope we can get her back. We're talking about, there was a key question for Teach to Reach 8. Helen, I'm just asking you to unmute. You must have hit the mute button by accident. All right, I hope we can get Helen back. And the questions were, how are you using digital technologies? How are you using them to connect with other health professionals, with the communities that you serve? Okay, looks like we've lost Helen. Helen, we're still hoping to get you back. All right, and this will happen. This has happened to all of us. It's okay. I think we got the gist of it. And
referrals to improve, reduce dropouts for immunization.
Helen, we lost you for about a minute. Can you tell us how you got to dropouts for immunization? You were telling us about how you networked one-to-one with somebody who told you about the benefits of using digital technologies. What happened after that?
So with the use of technology, we are able to network with other facilities. We are able to connect if we are using the same app, so that if my patient has it appears as a dropout for an antigen they have not received, if they received it in a different facility, then we are able to network technologically, and I'll know that this particular patient has received the vaccination.
Okay, very, very interesting. And so so I understand better. Unfortunately, you were cut off, so we missed a little bit of what you told us. But thank you, Helen Osowo, for sharing what you learned at Teach to Reach 8. Just as a reminder, well, let's go take a look at what's happening on social media. So we have, let's see, now we have Onojo Towo, who says hello. Onojo, what did you learn from Teach to Reach 8? Please tell us. You're on LinkedIn. We can see your messages. There'll be a small delay, but we'll come back. And Abubakar Musa, we'd like to know what you learned from Teach to Reach 8, because you just said okay. But and then Omolara Adeyemi, joining from the United States. Adesoji Odukaya says, I learned a lot from experience from colleagues about similar challenges concerning vaccination, and same with good results. Okay, that is very general. Adesoji, can you tell us one thing, one piece of information, one experience, one example that actually helped you get better or good results, as you say? And darling Ogbolu Peter, the same question to you. What have you learned, if you were with us on the 16th of June, from Teach to Reach? Dr. Ghulam Murtaza from Sindh, Pakistan, warm welcome to you. Please tell us, you're all connecting with us from Facebook. You're watching on Facebook. Tell us, just go ahead and type up a comment. We can see it. We'll share it with everyone and get the responses. The same with Lal Wali Khan from Afghanistan, so quite an international group. Lal Wali Asar, what did you learn from Teach to Reach 8? I know I'm repeating myself. The same question for you, Musa Ibrahim Kuna. All right, back to the Zoom studio. Just a reminder of what happened with this Teach to Reach 8. For those of you who may not be familiar, and just to show the growth over time, Teach to Reach 6 was on the 17th of June 2022, and there were 12,000 398 participants who contributed in various ways. Second, at Teach to Reach 7, that was on the 14th of October, 2022, we reached 13,676 participants. Health professionals primarily working at the local levels, but from all parts of the health system, over 80 countries. And the amazing number for Teach to Reach 8 on the 16th of June 2023 is, of course, 16,835. If you're watching on Facebook, YouTube, LinkedIn, Twitter, tell us, what does it mean for you that this many people, this many of your fellow practitioners, fellow health professionals connected to learn from each other? And then we're going to go back to find, yes, indeed, the key question of today's Insights Live is really, what did you learn from Teach to Reach 8? Now, many of you have selected a specific slide and are from the compendium of experiences shared ahead of Teach to Reach. So let me go quickly explain how this works. We asked you a number of key questions. You can see some of them here. Why do you work for health? Humanitarian settings, experiences of HPV vaccination, oral cholera vaccine. And you answered in massive numbers, over 1,250 responses that we then compiled into this compendium that you see here. And again, it's over almost 600 pages for the English contributors. We honor and thank all of the Teach to Reach 8 contributors. They're listed in the compendium itself. And it is you that we have invited to the Zoom studio today to hear directly from you what you retained, what you kept, what you're keeping, and what you're using from Teach to Reach 8. So let's find our next speaker. So we'd like somebody, I believe it was Ndayo Iwat, who has selected a specific experience that spoke to him. Ndayo Iwat, a warm welcome to you. The question you're interested in was specifically COVID-19 recovery, and this was a contribution from Pakistan with Aurangzeb Mughal. I hope I'm not mispronouncing too badly, who works at the regional level. Can you tell us, Ndayo, what did you find? Tell us what Aurangzeb's story insight was, and why you selected this one to comment and share your reflection and learning today.
Thank you very much, Rada. Thank you, everybody. I'm happy to be here. I believe I'm loud and clear.
Yes, indeed.
Oh, perfect. So, yes, I had to select this Pakistani contribution. We all agree that COVID-19 pandemic actually was like a very serious test on the health systems, infrastructure, and service delivery. The pandemic, actually, the effect of the pandemic spanned through all the sectors of the economy globally and impacted negatively on immunization. The gains for countries that have already gone far, done well in immunization, there was a decline. Then those that were borderline, even declined further. It was so embarrassing that epidemic, had to be seen on vaccine preventable diseases. So going forward, the pandemic is no more, but every country still has a plan, and the effect is still the recovering from the immunization, missed children, and zero doses. So we are looking at the Pakistani experience, that human-centered plan, programming, engaging the community, and really helped in reviving the immunization activities in this area. So I looked at it as a very relevant and important strategy at this time. And because this is also what we are doing in my own area of operations in Nigeria, that we have to adopt the human-centered planning, and then we have to use integrated approach, and then data management system that is, of course, ICT driven. So this is what I believe should be shared, and people that are having challenges can also benefit from the insights going forward. Thank you.
Thank you, Ndayo Iwat. So question for you. you are in Nigeria. There are many Nigerians in Nigeria working on COVID-19 recovery. What for you is the value of hearing from somebody who is halfway across the world in South Asia, in Pakistan? Why bother listening to Aurangzeb Mughal? What can you learn from Pakistan that is you may not learn as well or in the same way in Nigeria?
To me, this is a global platform, and having an open mind to learn is a very critical requirement to be on this community. And then looking at the support that the Pakistani had in adopting this strategy of community engagement and having to deploy digital technology successfully, these are the two things that if you are to do in Nigeria or where I work in particular, you have got to sacrifice some of your personal resources to get the work done. That is, we may have delays and incomplete or timely release of resources from government to drive the process. So in order not to waste time, or in order to be left behind, after mobilizing the community, you've got to use resources, even if it is in an interim, pending when the resources from government would come. But I've like the one in Pakistan, those delays weren't there because like it was a seamless programming coming from the national strategic approach to reviving immunization.
Understood. Thank you, Endayo Iwat. All right, let's see what's happening. There are more people joining on via social media. Adesoji Odukoya, who had introduced himself, says, using digital technology helps to improve prompt reporting, data collection, management, and dissemination. Adesoji, can you tell us more about how you know that, if you learned anything in relation to that in the during Teach to Reach 8? We have Abubakar Musa who wants to join our Zoom studio. Abubakar, if you are a Teach to Reach contributor, you received the invitation, contains the Zoom invite. Do join us if you're able to. And Adamu Abubakar from Shira LGA in Bauchi State. So, of course, I shared our rules on for fairness on speaking in the what we call the Movement for Immunization Agenda 2030. So we're going to ask a non-Nigerian Teach to Reach 8 participant to speak next in order to share again what you learned from Teach to Reach 8. Again, this is intended to be a very short session. It will leave you hopefully thirsting for more. So we're going to go, let's see. I believe we saw Dr. Tusime Ramadan from Uganda. Tusime, I think you just lost connectivity. And this will happen to all of us. Let's see if, let's try Belinda Uba, but I believe she is also from Nigeria. So please do raise your hand. We know that if you're here, it's because you took the time and the care to review the insights that were shared. So I don't know if we had this problem with the Francophones. There may be a glitch with Zoom today. I'm not sure, but we would love to hear from you. Let's go to Diana Koroma, Doniyu Hare. Dr. Manisha Danan, I don't believe we have heard from India yet. So Dr. Manisha Danan, be lovely to hear from you. Manisha, if you are able to unmute, we'd love to hear from you. There's always this process of figuring out who is going to have the connectivity at the right time and who's going to be ready to share. Dr. Manisha may be in her clinic tending to patients, children or adults. So we do understand that sometimes it is not obvious. Diana Karoma, I'm asking you to unmute. The same with you, Doniyu Hare, Doreen Awuku. Let's see, we've got quite a long list today. So,
hi.
Okay, wonderful, Diana Karoma. Great to hear from you. Please remind us who you are and where you work, and then we'd love to hear what did you learn from Teach to Reach 8 on the 16th of June, 2023. Go ahead, Diana.
Hello?
Yes, okay, so this is Doreen Awuku. Doreen, please go ahead.
I'm Doreen from Ghana. So I learned My focus actually was on human papillomavirus because for more indication, the awareness is not really intensive like other health-related issues. So that's where my interest is.
All right, and this was a special session presented by the Women Who Deliver Vaccines Collective. 600,000 new cervical cancer cases, 340,000 deaths each year, and a backsliding in coverage. Did you know, Doreen, did you know these numbers before Teach to Reach 8? Were you already involved in HPV vaccination?
No, please.
All right. And as a woman who works in immunization, what did you make of these numbers and what you heard from both Women Who Deliver Vaccines, but also national program managers, such as the one from Sierra Leone, and other participants explaining the challenges, but also the successes in introducing and scaling up HPV vaccination?
Well, immunization as a whole differs from every country. Like in Ghana, like this, I think we are doing well when it comes to vaccination, childhood vaccination. The uptake is good, but from other countries, I think they have deficiency as well. So I think ours should rather be more focused on the HPV. That there should be more advocacy and government to be more involved with this particular topic.
Very interesting.
Create awareness and encourage people for vaccination. And even availability of vaccination is also another issue, which maybe stakeholders have to look into that one as well.
Right. And in Ghana, where you work, are you going to be involved in HPV vaccination efforts?
Mine will be more of education because I am with the humanitarian units, Ghana Red Cross.
I see. Yeah.
We do more of the education and actually sometimes collaborate with Ghana Health Service to implement those programs. So not like vaccination in person, but more of education. I am a WASH project officer, and part of one component is on menstrual hygiene, where we educate adolescent girls on menstrual hygiene. And I think creating awareness of HPV is something that most people don't know. And even when you go to vulnerable communities, even some health workers may not even know experience. So I think this is one of the agenda that have to be really pushed by the country.
Thank you, Doreen Awuku from Ghana for sharing your experience and the significant learning from Teach to Reach 8. Now, next, we are going to shift to another topic we discussed at Teach to Reach 8, and this particular experience was a compendium of over 1,250 experiences that were shared before Teach to Reach. This one was selected by Helen Groves. She's going to introduce herself. Helen, if you are there, I'm asking you to unmute. I hope your connectivity will be fine. Do introduce yourself. And then if you could tell us why you selected this one from Pakistan, from Naeem Asghar, who works in the UNICEF country office and who was part of the team in Pakistan who implemented OCV in 2022. But first, do introduce yourself.
Hi, thanks. Yeah, I hope I have good connection. So my name is Helen Groves. I'm a senior research manager for vaccines, and I work at the Wellcome Trust in the United Kingdom. So I have a particular interest around the oral cholera vaccine, the barriers to using it, and the sort of questions, evidence, and data that people in country would like. I picked this experience because, well, so many reasons really. I thought it was really interesting that the public health specialist thought that an age-specific approach could have been taken to administering the vaccine rather than giving it to everybody, and that's something that I think is a particularly interesting question to explore. I thought the fact that the government was reluctant to announce the cholera outbreak to avoid economic implications was really interesting, because this is something that other countries have been concerned about, and it's an interesting topic to explore. And then I thought it was sad, I think, that the access to safe water wasn't improved during the cholera outbreaks, because I know that is something that people that are involved with the oral cholera vaccine are really committed to, that the vaccine is a temporary solution to a problem which really needs safe water. So yeah, that's why I selected this.
Thank you, Helen. I believe you have a significant expertise in oral cholera vaccine. Is there anything that stood out, surprised you, seeing these experiences shared by participants from all over the world, and participants sharing them because they choose to and want to? Did you detect or discern anything different about probably the many reports and research that you look at as you work on these issues?
I've actually thought that it was the similarity in barriers and problems, and the things that are being recognized at a global level are quite reflective of what people are experiencing on the ground. I thought that was really nice, actually. But I think one of the things that surprised me here was the reluctance to announce the outbreak to avoid economic implications, because I know that's something that WHO are really pushing against, that there shouldn't be any economic implications to announcing an outbreak. So it was something that I'll certainly take forward and talk to people I know that are interested in comms and advocacy about this.
Very interesting. And so I believe, was this your first experience of Teach to Reach, where you were able to attend and network and listen to the group plenaries?
I wasn't, sadly, but I was really interested to be able to see the insights afterwards. So I'm really happy to participate today.
All right. Thank you, Helen. I'm now going to turn to Jenny Sequeira. Jenny Sequeira is a global health consultant. And Jenny, I believe this one also caught your attention in that, let me go to the right slide. You also had some reflections or comments to share on this topic, on the OCV. That was one of the many topics discussed at Teach to Reach 8.
Yes, hello everyone, and thank you so much for this topic of OCV. I think in routine immunization, we often don't talk about the challenges with cholera. And we know that cholera is such a marker of inequity, and there are these stigmas around governments being reluctant to announce it. So what Naeem highlighted, and several others also highlighted in their OCV experiences, really stood out. And it was this: how do we work with situations where we may have shortage of vaccines? So I think part of Naeem's approach with age specific might be related to the potential shortages, but I'm not sure. And so it'd be interesting to understand what Naeem and others are doing when they do have a shortage, because we know that there are sometimes global stockouts of cholera vaccines. So what Helen highlighted resonated quite a bit around reluctance to announce. We know that places that have a lot of tourism especially are reluctant to announce, because tourists will then cancel trips when they hear about cholera in certain places. And we know that sometimes governments themselves will rename cholera acute watery diarrhea, especially for that around that issue of reluctance. So that concept of reluctance and stigma, we see it with cholera in many different countries, but it also connects to stigmas we see with other vaccines like HPV. With, Doreen mentioned around how she's working at Red Cross to raise awareness around HPV. There's some reluctance of some to not take the vaccine, and how she's using missed opportunities in vaccination approaches to think about how to connect menstrual hygiene. And when she meets with girls for that, to connect that back to HPV vaccination. So I think both with cholera, with HPV, wherever you have hesitancy, it's very important to think about what missed opportunities you have and to connect that with other integrated activities that are happening that can connect back to vaccination. So those are just some thoughts. Thanks, everyone.
Thank you very much, Jenny Sequeira. Going to go now, many comments in our Zoom studio and online with around HPV vaccination. So we're going to go back to HPV. Belinda Uba, you had a very interesting comment about the use of HPV vaccine. If you'd like to, I hope you're going to be able to unmute and tell us about it so we can hear from you. We only have 5 minutes left. I'm going to ask our guests of honor in the Zoom studio if you'd like to extend this session at the half-hour mark. That is an option that we keep when the discussion becomes interesting. But again, it has to be a decision by the group, and it has to be because you want to stay. Belinda Uba, a warm welcome to you. Please do introduce yourself. Tell us who you are and what you do, and what are your reflections on this HPV vaccination.
Yeah, thank you very much, Reda. I'm glad to be here. I'm Dr. Belinda Uba. I work with Affinet as routine immunization specialist and also work with the National Emergency Coordination Center. It's a center that actually coordinates routine immunization in Nigeria. So I work there as a program manager, deputy program manager for operations, and supporting the program manager and the deputy manager for the service delivery group. So the contribution I have around the HPV vaccine introduction for Nigeria, we have not introduced HPV vaccine yet. However, I think with this interaction, a lot of lessons are actually being learned from what the experiences have had or have been in other countries, and how that can actually help us as a country to better shape our introduction, which we plan to have sometimes the third quarter of this year. Really around the engagement of women, the engagement of women groups, women organizations, having women in the forefront actually to ensure that we have a successful introduction. Issues around hesitancy, how we address that, integrating it with other activities, having to engage more civil society organizations, NGOs that are working around adolescent health, the girl child, how to fully have them on board and ensure that they are all part of the planning and working towards a successful implementation. I think it's something we're actually learning from all these discussions, and it's also helping us as a country to equally shape our plans and really ensure that we have that successful introduction. We are targeting girls in our first phase of introduction, and we'll have that in the next quarter. Hopefully by next year, we'll be having that across the entire country. So it's a lot of lessons learned from my part here in Nigeria. And I believe my other colleagues who are equally here are actually learning lessons from other aspects that we've been discussing in the course of this session. Thank you so much for the opportunity, Reda. And
thank you. Thank you, Belinda. We're 2 minutes away from the halfway mark, so we're going to take a poll. If you'd like us to extend this session a few more minutes in order to hear more voices, I see many hands raised and microphones ready to speak.
Meetings do not end.
Please type yes into the chat. And if you do not, if you need to go, just please go ahead and type no. All right. Boma Otobo says yes. Samuel Adjinson says yes. Ndayo Iwat says yes. Jenny Sequera says yes. Belinda Uba says yes. Okay, I see. And if you're on YouTube, Facebook, Twitter, do the same. There's a bit of a delay, but we want, okay, Chichi and Kire says yes. Please do introduce yourself. Okay, you're joining from Lagos, Nigeria. Tell us what you learned from Teach to Reach 8 as well. This Women Who Deliver Vaccines was indeed a powerful moment, hearing firsthand from women who work in vaccination. So Dr. Tusime Ramadan, you are from Uganda. You run a volunteer organization that is involved, I believe, in epidemic response, in particular on the border with the Democratic Republic of Congo. Could you tell us what you learned from Teach to Reach 8 and how is it helpful to you? But please do tell us more about who you are and what you do. I know last time. Go ahead.
Are you getting me?
Yes, loud and clear.
This is Dr. Tusime Ramadan from Uganda, a retired medical doctor. Currently working with Humanitarian Volunteers International. It's a country director, and it's a volunteer working CBO community-based organization. And what I learned from Teach to Reach 8 is that if we are united and we work together, zero dose is possible. And coming up for emergencies is very, very important. And we can get our target by 2030.
Thank you, Dr. Tusime Ramadan. Yes, can you tell us what is the latest outbreak that you have faced on the border with DRC in your community that you and your team of 150 volunteers responded to? What disease were you facing, and was there a vaccine available to support your efforts?
The latest was yellow fever in about 3 weeks behind, and we worked on the border and with the neighboring Congo and the districts bordering Congo. So it was yellow fever, and the medicine was good because we are contracted by the Ministry of Health. So the yellow fever campaign went on well, including the people from Congo and Uganda.
Thank you, Dr. Tusime Ramadan. Let's go now to Flora Egwu. Flora, would love to hear from you. Please do remind us who you are and what you do, and share with us what exactly did you learn. You are probably very busy as immunization staff, immunization professional. Why take your time out, your precious time, to sit and listen and learn and network at Teach to Reach 8?
Yeah.
Flora, we hear you loud and clear. There may be a delay, so please introduce yourself.
My name is Flora Egwu, Rev. Nigeria. I have learned from the sharing programs, sharing session, sharing experiences, because I have come to discover that the challenges I have here is similar in other areas. They too have their challenges, but while listening to their experiences, I was able to get how they overcame their challenges, which I have started applying in my own country here, and I'm getting good results. And in sharing the challenges, the brainstorming in getting the solutions has also helped me in the work I am doing here. It was in the sharing experiences that I learned that HPV is not known yet. Well, vaccine is not well known in Nigeria. It's not being well publicized. When one of the Nigerian retired directors said that she worked in Delta State, and in the schools that the girls, among the girls she asked who has ever heard about HPV vaccines, none of them accepted to have heard about it. That made me to understand that I was not alone, because I know HPV, but I didn't know that there have been a vaccine for it. So, but with the knowledge I gained from the experience shared by others, I now know that there are.
I've lost Flora. I hope we can catch the last part of that sentence, but I believe we know what to. We got the gist of it. Flora, sorry, we won't be able to hear the final part of your sentence.
Vaccines for it, and I will now set section there. So I will use the experiences shared to now use it to cascade down to the oncology unit of our hospital, and see how girls especially can be coming to check on their status concerning HPV.
Thank you very much indeed. Now, Essa Jama has asked to speak, so we're going to go to Essa Jama. Jama, I hope I'm pronouncing your name not too incorrectly. That's also part of being involved in this global dialogue. Essa, you wrote, I believe, that you faced, you carried out cholera, you were involved in carrying out cholera vaccination in response to an outbreak in southern Nigeria and Cross River State. Please start by introducing yourself, and then tell us, having heard Helen Groves and Jenny Sequeira reflect on Naeem Asgar's contribution, what would you like to add to this discussion? What did you learn from Teach to Reach 8?
Hello? Oh. Okay,
yes.
My full name is Issa. My full name is Dr. Issa Chama. I'm currently working with Doctors Without Borders, Médecins Sans Frontières. I'm based in Cross River State, Calabar. Is anybody hearing?
Yes, loud and clear.
Okay, so I am just in Calabar. There was a cholera outbreak in December, and we are closely working with the Cross River State Minister of Health. And there was 4 LGS districts that was confirmed cholera. So we responded. It took us, there was a week 8 and week 9 was the big side. And recently we conducted a cholera vaccination campaign, and it was successful. We are also dealing with diphtheria, but that was the cholera experience. Thank you so much.
Thank you, Essa. Did you share this experience with your peers? Were you able to network and share that you had this successful experience with cholera vaccination?
Okay, let me draft now. I'm doing.
Okay, I appreciate that, Essa. All right, and I
thank you so much.
Yes, and we know not everyone is able to share, but if some people share, this still adds up to a massive compendium of experiences. As I showed earlier, let me go to the right screen. The compendium of Teach to Reach 8 shared experiences, combined English and French, over 1,250 experiences, including, 108 shared on OCV. But of course, the more, the merrier. So thank you for sharing, Essa.
Thank you. Thank you. I have a nice presentation. I will share with you as soon as possible now. Thank you so much.
Okay.
Thanks for all the students and everybody and the Chinefa Learning team. Thank you.
Thank you very much indeed, Essa. And one last question. Will you be at Teach to Reach 9 as we're winding up? There's some important announcements that I'm going to share. And actually, the first one is that Teach to Reach 9 is now scheduled for Friday, the 13th of October. Will you be back for more in October?
Yes, I will be definitely and contribute and I'll be active. Thank you.
All right, wonderful. And you know I will be looking for you in the plenary room when we get started. Thank you, thank you, Essa. All right, we've heard from parts, a number of countries in Africa. It would be lovely to hear from Asia, people from Teach to Reach 8 practitioners from Asia and or Latin America. So I know that Maria Monzon, an IA 2030 movement leader from Argentina, is with us. But I believe there was also at least one other person. If you could raise your hand, we'd love to hear what you learned. I believe it was Fabiola Quiroz. Fabiola, are you able to speak to us? We want to be asking you to unmute. Fabiola, are you able to speak to us? Looks like you may not be. All right, then we're going to go to Maria Monzon. And then we also need to hear from India, Pakistan, countries in Southeast Asia as well. So please raise your hand so we know who you are. All right, Maria, always a pleasure. You are well-known, very engaged and very committed leader in the movement for immunization Agenda 2030. You've been, how many Teach to Reach sessions have you participated in?
Oh, all of them. I really like Teach to Reach. I participated since number 1, so very proud and very happy every time to be there. And this one was particularly one that really, it taught me a lot. I was listening now, everybody commenting on HPV vaccination. And in Argentina, actually, the HPV vaccine is part of the calendar since 2011. So it's been a long time. And since 2017, it's also for boys. So we've walked a lot. And I was thinking, I missed so much about all the effort and everything that, everybody did and how hard it is. And listening to all of everybody telling how, they're talking into how the impact that it takes, it really moves me on, how sometimes we are a bit ahead and we kind of forget that it took a long walk to get where we are. So I just wanted to comment now that I was yesterday they were presenting here in Argentina the dengue vaccine, because we have a lot of outbreaks now. So I guess at some point in another Teach to Reach, we will start talking about the dengue vaccine, because that is another one that is going to affect us all. And it was really interesting. And I'm like, well, I'm looking at the first steps here. So we haven't used cholera vaccine either, but it's incredibly interesting always.
Yep. Yeah, thank you, Maria. A question from our Zoom studio. Can you explain why Argentina decided to include boys in HPV vaccination?
Yeah, well, the coverage was good for girls, but boys, they will still transmit the disease. So because we already had 2 doses with a high coverage, then it was decided that boys, and they have the same doses, one at 11, one 6 months later. And it's working pretty good. So it's prevented a lot of cases of cancer and everything, obviously. So it's been like that for the past 6 years since it's been included with boys. So yeah, but it's been a long time. So I guess that once you have all girls covered, then you can go for boys too.
Thank you, Maria Monzon from Argentina. Gifty Akosua has had her hand raised. I'm hoping your connectivity will allow you to speak so we can hear your voice. Gifty, are you able to unmute? I'm asking you to unmute, so you now need to accept the invitation. And we've called for Latin American and Asian participants of Teach to Reach. There were actually a significant proportion of the total number of participants. We, of course, know by country. So if you are from one of those two continents, please do raise your hand and let us know. As we wrap up this Teach to Reach Insights Live, where we really recap 3 weeks after this event, 16,835 professionals. All right, here's Gifty. Gifty, please do remind us who you are and what you do, and share your reflections. What did you learn from Teach to Reach 8 and from today's conversation?
Hello, everyone. Yeah, my name is Gifty Akusiajibe from Ghana. From the Teach to Reach, a gentleman called Castro. Castro spoke about how he was able to develop a schedule that was able to help him in his community. Yes, we know that for you to be able to work very well, be able to achieve your goal, to be able to get all the children that are in the hard-to-reach areas, you need to have a plan with the caregivers and also the the community health workers. And that was what he did, because he realized that some people are still having children that were not vaccinated. Why? Because the health workers were going to the community at the time that mothers were not available. Either they were going to the farm, they were going to the market, or they were just not available. So it would be better to have a meeting with them so they can all come to agreement on a set date that they'll be available. And that really helped him to be able to treat many defaulters and be able to increase their coverage. Yes, so that is what I've learned, that for you to be able to achieve that goal, to leave no child behind and to bridge up that catch-up bridge, then it means you should be able to have a meeting with your caregivers. You don't have to decide for them, but then you come to agreement. That is the only way.
Thank you very much, Gifty Akosua Adzigbe, for sharing what you learned from Teach to Reach 8. We're going to wrap up, so I will do one last call. If you really, we'd like everyone who had prepared a slide, everyone who had really wanted to share their reflections. We thank you for coming to the Zoom studio. Even if you're on Facebook, Twitter, LinkedIn, wherever YouTube, wherever you are watching this Insights Live, please do share. We're looking for your last final contribution. So raise your hand. I do have a number of exciting announcements that I've been waiting. I've been waiting actually since the beginning, but saving the best for last. The first announcement is, in fact, Teach to Reach 9. So we've set the date for Friday, the 13th of October 2023 at the usual time. It's always on a Friday, 3 to 6 months after the previous one. That has varied over time. Want to acknowledge the great quality of the comments and dialogue in our Zoom studio. Unfortunately, there is no way for me to show you that. So now the next announcement is just to highlight that you can find, if you were not a Teach to Reach 8, but you would like to know more, there are two parts to Teach to Reach. One of them you will find on the YouTube channel, and that is what we call the group peer learning, where we come together in plenary and a few people speak, everyone listens and share their comments. The second part, unfortunately, you have to be there at the time and online at the right place and time in order to participate, and that is the networking. But you will find a lot of great content. There's actually a Teach to Reach playlist. Let me see if I can find it. So if you go on our YouTube channel, the important part is really to subscribe and turn on the notifications so that you do not miss any of the content. If you go to videos here, don't get confused if you see things in French. Many of the sessions are once in French, once in English. So if you hear French, just look for the equivalent session. For example, the HPV session, which was really, truly powerful, you'll find right here. So that is the YouTube channel. Just search for the Geneva Learning Foundation. Now, second, if YouTube doesn't work for you because of bandwidth, because of connectivity, you can go to Google Podcasts or Apple Podcasts or Spotify, whatever is available in your country, and search for the Geneva Learning Foundation. You have the audio-only content, so it's a lot less costly than going to YouTube, and it's a very convenient way. You can listen on the go. Of course, you lose some of the things that may be on slides, but you can hear and listen to all of the content that we live stream to our YouTube channel. So that is two of the announcements. Also want to bring you to your attention our LinkedIn page. We're doing a lot on LinkedIn right now, including sharing the World Immunization Week images. We received so many that for the Geneva Learning Foundation, it is now World Immunization Year, because we received so many pictures. We want to honor them all. You can see the latest ones here are also posted in French and in English. This one from Taban Ayub Milua from Upoi village in South Sudan. This one from Mary-Louise Vender West Huizen from South Africa. So you can see here, and they're posted every Friday. You can find new pictures if you haven't seen your own yet. Keep checking, so you'll see a lot there. And now for the announcement that I've been eager to make is that for the very first time at the Geneva Learning Foundation, we're going to support a special event by and for health professionals who are concerned about the consequences of climate change on health. And this is supported by Bridges to Development and the Geneva Learning Foundation. The title is From Community to Planet, Health Professionals on the Front Lines of Climate Change. I'm going to share all these links for those of you who are in our Zoom studio. Before you go, make sure you grab the links, because they won't be available afterwards once the Zoom room closes. So that's all the ones I've referred to. If you're on YouTube, LinkedIn, Facebook, then that means you probably already know where our page is. You can see all of the links here. But that request, your invitation to a special event From Community to Planet, it will be on the last Friday of this month at 3 p.m. That's always Geneva time. You should see your local time here. We encourage you of course, to join if you're concerned about climate change and health. And we believe that even though most of you, of course, work first and foremost on immunization, it is likely that you are uniquely positioned because you work closely with children, their families, with the communities. You are likely to be seeing change in climate, changes in health. And so we've asked you that you will see there's an opportunity to share your experience and tell us what changes you're observing. And if you think they're related, tell us why they're related or not. So those are some that will be coming up. You can go and register right now, and also share on WhatsApp, on LinkedIn, Facebook. That always helps. If you know other health professionals who are concerned about climate change, this is really the first time a unique opportunity to share. All right, wonderful. Thank you so much. And now back to the Insights Live. Thank you very much. I see Dr. Manisha Danan is unmuted. Manisha, is it possible to hear from you before we close? I was hoping we could hear from India at least once. All right, so then hold on a second. Don't leave the Zoom studio yet. Dr. Manisha Danan, what did you learn from Teach to Reach 8? Don't forget to introduce yourself.
Myself, Dr. Manisha Danane from India, sir.
Right.
I am a homeopathic doctor. And each and every point shared from each and every individual was as much required policy for each and every country. Everything noted by the experience shared is a book of Bible for the immunization. It's as equivalent to that. And I'm thankful for being part of it, and I'm honored to share my experience today, sir. Thank you.
Wonderful. Thank you, Dr. Manisha Dana. We tried to hear from you earlier. It didn't work out. So once again, want to congratulate and honor all of the Teach to Reach participants. This is... We went 20 minutes overtime because you asked for it. You asked to extend the session. Not everyone could stay, of course, but those of you who did, thank you. And we, of course, understand if you couldn't. You can always catch up with the recording. The recording is immediately available on our YouTube channel. You do not need to wait. You do not need to wait the next day or request the slides. The full compendium of experiences shared at Teach to Reach is available. It's a CERN based, so that's the European Center for Nuclear nuclear research. They provide the repository where the Geneva Learning Foundation, we're right next door, hosts all of our publications and data sets. So you'll find that is openly available. Even if you were not able to attend or contribute to Teach to Reach 8, you can still now access this new knowledge. Want to highlight also that the Geneva Learning Foundation, in support of the movement for Immunization Agenda 2030, has set up the Knowledge to Action Hub for IA 2030. So you go to the Geneva Learning Foundation's website, you'll be able to find it. You'll get access to the latest resources and receive notifications when there are new insights, new knowledge produced by practitioners like yourself. Once again, thank you and take care. Thank you, Dorina Wuku. You just wrote with a emoji with 2 hearts in place of eyes. I love Teach to Reach. We certainly do too. I hope it's useful and practical and that you're putting it to use, and we'll do that consciously, intentionally in the coming weeks and months. You'll tell us about it on the 13th of October for Teach to Reach 9. Take care.